Hi, let's talk about the major vascular pathways of the head, neck, and upper limbs. In this video, we'll diagram the major vascular pathways, both artery and vein, of the head, neck, and upper limbs. Let's begin with the aorta. The aorta is the largest artery of the body. It's likely the most impressive vessel of all of the body. Its three parts are the ascending aorta, the arch of the aorta, and the descending aorta. The ascending aorta leaves the heart, conducting blood from the left ventricle, and it feeds directly into the arch of the aorta. From there, it descends, and it has two parts. The part within the thorax is known as the thoracic part, or thoracic aorta. Once it crosses the diaphragm, it's known as the abdominal part, or the abdominal aorta. But let's focus on the branches of the arch of the aorta. The first major branch is the brachiocephalic trunk. Let's think about that name. Brachio of the arm, cephalic of the head. So there are going to be two major branches here, the right subclavian artery and the right common carotid artery. Subclavian arteries conduct blood largely to the upper limbs, but they also supply the walls of the thorax and abdomen, as well as the brain, as well as elements of the neck. So those subclavian arteries do a lot, and we'll talk in granular detail about them in a subsequent video. The common carotid artery is going to ascend the neck within the carotid sheath. Recall that that contains the common carotid artery, the internal jugular vein, as well as the vagus nerve. And it's going to bifurcate into internal and external carotids, which we'll see. The next branch off of the arch of the aorta is the left common carotid artery, which mirrors the right common carotid artery. And then the typically final branch is the left subclavian artery. So we'll have two subclavian arteries and two common carotid arteries coming off ultimately from the arch of the aorta. It's just that the vessels on the right side come from that brachiocephalic trunk. So the subclavian artery on the right originates at the brachiocephalic trunk. On the left comes from the arch of the aorta. It's tripartite. So from its origin until its terminus, which is at the lateral margin of rib 1, there are three parts. And these parts are designated by their relationship to this muscle here, which is the anterior scalene muscle. Everything medial to the anterior scalene is the first part. Any branch that comes off behind the anterior scalene is from the second part. And anything that comes off of the artery lateral to the edge of the anterior scalene is of the third part. The subclavian artery, when it crosses that plane of the lateral margin of rib 1, becomes the axillary artery that will be transmitted through the axilla. The common carotid arteries, as I've said previously, are ascending the neck within the carotid sheath, and I'll draw those margins of the sheath there. Those are condensations of deep cervical fascia, and the major constituents are the common carotid and its branches, the internal jugular vein, the vagus nerve, sometimes ansa cervicalis, which is a motor branch of the cervical plexus, can either be embedded or within that sheath. And superiorly, we'll also have the glossopharyngeal, so cranial nerve 9, and the accessory cranial nerve 11 transmitted through the superior portion of that sheath. Now, the two terminal branches of the common carotid artery are the internal carotid artery and the external carotid artery. And these names are very helpful. The internal carotid artery keeps ascending. It has no branches in the neck. It enters the cranium through the carotid canal of the temporal bone, and then it goes superiorly to serve the brain as part of the cerebral circle of Willis. It has some branches then that will exit the skull, namely the ophthalmic branch, which is transmitted through the orbit, which serves the orbit and portions of the forehead with blood. The external carotid artery is going to supply the portions of the neck, the face, and the scalp, as we'll see. So here's a lovely illustration of the external carotid artery. We'll notice that it is anterior in position to the internal carotid artery. Its first major branch is the superior thyroid artery, which we've discussed already, and there's a branch off of that, the superior laryngeal artery. The next major branch is the lingual artery that's going into the sublingual space to serve the tongue and other contents of the sublingual space. Sometimes this artery shares a common trunk with the next artery, which is the facial artery. The facial artery hops over the mandible and supplies the face with blood. There are also a few posterior branches here. So the ascending pharyngeal artery. The ascending pharyngeal artery goes deep to serve the pharynx with blood. There's an occipital artery, which serves the occiput with blood. A posterior auricular artery. Auricular means ear, so there's the external acoustic meatus, so one might imagine an earlobe there. That artery runs posterior to that ear, serving the auricle of the ear as well as the skull posterior to that ear. There's also a maxillary artery, which we can't see here, but is a terminal branch of the external carotid. The maxillary artery serves the deep face, so the infratemporal fossa, and it's ultimately going to even serve the nasal cavity. And then the other terminal branch is the superficial temporal artery. That superficial temporal artery serves portions of the face as well as the majority of the scalp with blood. We can see here as a posterior view, so the vertebral column's been cut away. We can see the common carotid artery. There's the internal carotid artery heading up into the cranium. You can see superior thyroid, lingual, facial, and then a couple of other branches that I'd rather not speculate on their origin without seeing where they're targeting. The veins are quite elegant in their overall layout. So when we think about the venous drainage of the head, neck, and upper limbs, let's think about that same pattern of arterial flow. So the arteries have the subclavians and the common carotids. Well, the veins have subclavian veins that drain everything that the subclavian arteries provide with blood. So there are right and left subclavian veins. And there are right and left internal jugular veins. We discussed these in the context of the carotid sheath. So we can see that these IJV are descending the neck. They would be in that carotid sheath. They're meeting up with those subclavian veins to form the venous angle. The venous angle is just that juncture of internal jugular vein with subclavian vein. That marks the beginning of the brachiocephalic veins. So there is a left and a right brachiocephalic vein. We can see the left brachiocephalic vein there. The left brachiocephalic vein is crossing over the midline, and it is running anterior to all of the branches of the arch of the aorta, and sometimes even the superior portion of the arch of the aorta itself. So it's in very close proximity. That left brachiocephalic vein is longer and more oblique than the right brachiocephalic vein. And where these two veins come together, we form the superior vena cava. The superior vena cava is draining all of the blood superior from the diaphragm down into the right atrium of the heart. So we've discussed all of the major vascular pathways of the head, neck, and upper limbs. Many of these will go into much finer, more granular detail as this sequence and as the course progresses. This is your summary slide. Thank you very much for your time.